We're moving to the next bone issue, which we are looking at how the x-rays will look like. And this is what is known as the congenital pseudarthrosis. Congenital pseudarthrosis. This is how the x-rays will look like. So we'll quickly try to describe it, talk about it and all of that. So congenital meaning you're actually born with this condition. Okay, so you should know that it's a rare condition, and this is where a segment of the bone is failing to form normally. So you are having something like a false joint. So it most often affects the tibia, that's a shin bone, though other bones can also be affected. Okay, and of course the patient will always have some other associated issues. So radiographic features is what? Can you see how a bone is kind of like discontinuing? Okay, so this bone discontinuity. So the affected bone will show a clear break or gap. I seen it. Very pure, very clear. I seen it. Tapered bone ends. Okay. Cystic changes. Angulation or bowing. Okay. False joint formation. That's why they say pseudo. Something pseudo is like, almost like, but not like. Okay. Associated findings, you see fibrosis, where you see all those bones are usually very soft. Okay. So typical sites, the tibia is affected, the fibula is affected, radius can be affected, the ulna can be affected, the clavicle can be affected. So it presents in childhood with bowing, and those children, they easily get fractured. And when they fracture, if you try to unite the bones again, it's usually so hard. So it leads to limb shortening and deformity, and they have difficulties in walking.